But we have two more short presentations before we open it up to discussion, and I would encourage people to start sending questions, comments for the discussion via the discussion box, which is under the live screen. I'm going to turn it over to Cheryl Nass now, who will talk about some of the things the National Academies, the Institute of Medicine, when that entity existed before it was changed to the National Academy of Medicine, and some internal reorganization in the National Academies a few years ago, to talk about some of the ways that the National Academies have talked about and thought about access going back several decades. This has been a topic of multiple different consensus studies and reports from the academies. So with that, Cheryl, perhaps you can take this a bit further.
Thank you, Dr. Kaiser. Good morning, everyone. On behalf of the Board on Healthcare Services and the Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine, I would also like to welcome you to the workshop. And thank you for taking time out of your very busy schedules to participate in these discussions on the important topic of patient access to care. This topic has long been a focus of work at the National Academies. Examples of some of the most relevant reports are shown here. I will touch briefly on some of the key recommendations from each one, but I also want to remind you that all of our reports are available online free of charge from the National Academies Press at nap.edu. This report on access to healthcare in America, going back nearly 3 decades prior to the broad implementation of EHRs, noted the need for better access, for better data on access in order to monitor and improve patient access. This report, one of the most widely known IOM reports, Crossing the Quality Chasm, defined 6 key attributes of high quality care in 2001. The high quality care is safe, effective, patient-centered, timely, efficient, and equitable. And timeliness in particular refers to reducing wait times and harmful delays in care. This report from 2005 recommended interdisciplinary collaboration to build a better healthcare system with emphasis on information technology and interoperability. A subsequent report on health IT and patient safety in 2012 emphasized the role of human factors and human-centered designs for improving healthcare and access. A workshop in 2012 reviewed the evidence base for various technologies used in telehealth in diverse and evolving care settings. A report published in 2015 proposed a core set of metrics for high-quality care. The committee defined care access as one of those core measures for care quality and recommended 3 priority measurements for access: unmet care need, usual source of care, and delay of needed care. This study was undertaken to recommend solutions to scheduling challenges within the VA health system specifically, but the report findings and recommendations are broadly applicable to the U.S. healthcare system. The committee proposed actions at the national level as well as the level of healthcare facility, including development and implementation of principles and standards, financial incentives, and continuous assessment, along with patient and family engagement along the way. Last year, the National Academies hosted a follow-up workshop sponsored by VHA to consider the key operational characteristics and functionalities of a state-of-the-art patient scheduling system, as the VA was preparing to transition from its legacy EHR system to a new commercial system. Presentations highlighted the importance of design, implementation, and adaptability of scheduling systems to ensure timely patient access, as well as care coordination and care continuity. As with the 2015 consensus study, the presentations and discussions were broadly applicable to the U.S. healthcare system, not just the VA system. Another workshop in 2019 examined barriers, policy initiatives, and opportunities for improving access to and equity of care for people living with serious illness. Also in 2019, the Board on Healthcare Services released a consensus report with recommendations for integrating social care into healthcare delivery to improve patient access and outcomes. The study committee proposed 5 activities: awareness, adjustment, assistance, alignment, and advocacy to address the social determinants of health, ways to build a workforce and financial incentives to support this integration, and strategies for research and evaluation of new practices. Another consensus report in 2019 emphasized the importance of system design in healthcare to reduce clinician burnout and to support the delivery of high-quality care. We also currently have a study ongoing, co-sponsored by VHA, which focuses on strategies for implementing high-quality primary care, considering a broad range of factors that includes the primary care needs and access of different patient populations. You can find more information about the study at the webpage listed here, and we would welcome input to the committee's deliberations throughout the course of the study. In closing, I just want to briefly summarize a few key themes that have emerged across the nearly 3 decades of work on patient access at the National Academies. First, our reports consistently emphasize the need to focus on the system first, not individual clinicians or clinics, and to make it easier for clinicians to do the right thing. Second, our reports stress that access should be patient-centered and personalized. There is no one-size-fits-all for all patients and or populations. And third, our reports underscore care for the whole patient, including addressing the social determinants of health. And finally, I also want to thank the VA for sponsoring this workshop, and I look forward to the remaining presentations and the rich discussions that I'm sure will follow. So with that, I'd like to thank you for your attention, and now I will turn it back to Dr. Kaiser. Thank you.
Thank you, Cheryl. Appreciate that overview, and again would encourage folks to access those reports, which are freely available online.